October is Spine Health Awareness Month, and back and neck problems are common for a lot of people, especially during this time of year. If you're looking for something to relieve that pain, there's a tool special to Michigan to help treat the discomfort. Jordan, who doesn't experience some form of neck and back pain, especially as you get older?
Yeah, I think I might have some neck and back pain already, Doctor. Dr. Cogan here with us today. Thank you for coming in. Let's just first start with the month, right? Spinal Health Awareness Month in October. I mean, really, as Lauren said, everybody experiences some sort of back or neck pain, whether you're sleeping on it wrong, whether it's an injury. I mean, just take me through that. Can you self-diagnose yourself and treat that, or do they need to come see Dr. Corgan?
It depends how bad you are. I mean, if you have an ache or a pain from playing a sport, it's usually self-limiting. 1/3 of Americans have back pain or neck pain each year, and it's, if it was contagious, it would really be an epidemic. And it's kind of, the biggest problem is because of how we've traditionally treated it. You really only had a couple options. One is to live with it. Like if you have a disc problem or spinal stenosis or degenerative or bulging, you really have a couple options. One is to live with it. Problem with living with it, it's degenerative. Two, you can manage it. A lot of ways to do it. Anti-inflammatories, painkillers, physical therapy, chiropractic, acupuncture, massage, epidurals. Any and all these things can help you feel better, but they don't do anything to repair the disc. So the only corrective option was really surgery, right? The problem with surgery, spine surgery, doesn't have great outcomes and often leads to another surgery. So we developed a system to repair discs that's an alternative to surgery.
So that's why you got into practice.
Yeah.
I mean, what system works best for you? What have you come up with that helps people?
So we came up with a process called intradisc neutrosis using Dislogic. It's a non-surgical method to repair the disc rather than just treat the symptoms like those other therapies and prevent a problem from coming back. And one of the things that's really interesting is I was skiing in Chile this past August with my son.
Yeah.
And we do really extreme stuff, and I blew out a disc. And
you knew right away.
And let me tell you something, drugs, therapies, epidurals, any of it would have been good at the time, but I came back and I fixed my problem, and then I decided I never want it to come back. And that really is the key. So I brought in a new device called the Spine Force. And the Spine Force is a three-dimensional dynamic machine. It's the only one in the world that incorporates real-time feedback.
This is something that you have developed.
No, I developed intradisc. We developed intradisc neutrosis. Spine Force is a device that comes from France, a company called LPG.
Okay.
But we have the only one in Michigan.
Okay.
Because I decided I don't ever want to go back, and I'm not going to do the things. I'm not going to skip doing those things with my son skiing. So I need to become super strong.
Yeah.
And that's what this machine's for. It's for people with mild or moderate back pain, but especially to make it strong.
What about affordability? I think a lot of people might be hesitant to go get back or neck help because it really does become something. You can't just go one time most of the time, right? It's a follow-up visit after follow-up visit. Why would someone come see you with affordability in mind?
Well, the real issue is our process is not designed to just manage the pain. It's to fix the problem. And if you look at the cost of back pain over a lifetime with missed work and whatever you pay, if it's reasonable, is well worth it if you're treating the cause. But if you're managing the symptoms, that goes on forever.
Probably a good message, especially for everybody watching at home. Before we let you go, where can people come and see you?
So we're in Farmington, Clinton Township, and Grand Blanc. The simplest thing to do is call 586-416-DISC or go to nervediscinstitute.com. This month through Thanksgiving, we're offering a Spine Force evaluation and first session, normally $167 for only $67, and we've got packages that are half off. And if someone has a severe problem, I'm donating my time through Thanksgiving for a comprehensive 2-day consultation where they meet with my assistant first day. Second day, they meet with me. Normally something like that in a doctor's office would be well over $300. I'm doing it for no charge to see if we can help them. I can't promise we can help.
That's great.
But if we can help, we'll tell them.
The spine whisperer. That's what I heard they've been calling you. I've heard that. Spine neck whisperer, right?
Yeah, I guess. So well. I try.
Yeah.
I try.
Thank you, Dr. Corgan. Again, appreciate your time on the show today.
My pleasure. Thank you.